thanks so much for coming on the podcast today.
Thank you, Mindy. I'm thrilled to be here.
And we are both wearing our emerald.
Of course.
Because we are going to introduce who you are. And so let's do this. I would love for you to introduce who you are. You are Katie Montgomery with Emerald Counseling.
Absolutely.
But I kind of want to like up front sort of like address who this would be a great episode to listen, to share, to save for later, kind of hit like really what we're going to, what the biggest impact is, like who you're helping. And then I want to get into your backstory, where you're from and everything.
Okay. So, Well, that sounds great. Well, thank you so much, Mindy, for having me.
Yeah.
My name is Katie Montgomery. I am a licensed professional counselor here in the Kansas City area. I'm also an adjunct professor at Park University. I'm a coach, and I also do speaking and presenting. So, but in my work as a therapist, I own my solo practice, which is called Emerald Counseling Services. And we're wearing the green for Emerald.
On purpose.
So, love the color. So I own Emerald Counseling Services. My physical office is located in Corporate Woods. And I help my clients navigate through life transitions, everything from anxiety to depression to trauma to anything, really the whole scope. I see adults only, so I don't see children, but adults. And then I've found a real niche in a couple of populations. The first one being men. I have a lot of men on my caseload, and that's kind of a sweet spot for me. I also see a lot of women our age and older. Life transitions especially seem to be hitting women. And even when we talk about things like health concerns, perimenopause, autoimmune,
hot topic,
menopause, right? These things that we weren't really taught about are now getting more research and more airtime, which is fantastic. And women want to know more about how that physical change in their body is affecting their mental health. And it does. And so that's another niche. And then I really have enjoyed a lot of my focus right now has also been on high performers. So high achievers, perfectionism and things like that. And that we can talk about trauma and how all of those things kind of relate, because all of these populations that I see, every client that I see has experienced trauma in one way or another. And the definition of trauma isn't just something horrendously bad that happened one time. Right? People have that misconception. So we can talk a little bit about that if you want. So I think for anyone who is interested in therapy or the therapeutic process, what it might look like, this would be a great episode for them to tune into. Therapy isn't as scary as it may seem. I also would like to sort of talk about how there is still a stigma.
I have that on my list.
Oh, good. Okay. And how we're seeing it even now, even
though we've come so far. Even though we've come so far, because you and I are of the generation where there was no discussion, there was no suggestion of a therapist, probably in the most extreme situations, I would imagine.
That's exactly right. And it was only if something was really wrong. Really wrong. Really wrong. Like if you were crazy, quote unquote, right? And now therapy is more of a tool that I think everybody should have at some point, because it can give us so much self-knowledge and help us navigate all of this stuff. Life is hard. Life is just really hard, no matter where you come from.
I feel like the older, I'll just speak for myself, the older I get, in ways, the easier it gets because you're more wise and you have more experience. But on the flip side, the harder it gets, because then you also have so much weight that you're carrying and so much responsibility and so many things that you're starting to look back and be like, gosh, how did I get here to, for this to affect me that way?
Absolutely.
Just so many things.
There are so many things that factor in, and it starts from childhood. It starts from pre-childhood. I mean, it is we're talking generational stuff that gets passed down to us that we carry with us. And you mentioned, well, it kind of gets easier as you get older, and it does. The perspective, we develop wisdom and coping skills, and that's fantastic. And then sometimes there's also stuff that we need to kind of deal with. So,
of course. I mean, I know people who went to therapy for the first time in their late 40s.
Absolutely. Absolutely. And let me just say, there is no age limit.
Right.
My oldest client right now is 86, 83, 86. I've had as old as 88.
Okay.
And they come in at all ages. People come in at all ages wanting to know more about themselves. How do I move through this particular event or this part of my life, or how do I just feel better?
Yeah.
And that's my job.
Yeah.
Is to kind of help them.
Obviously, everything we'll talk today will be anonymous with people that,
Of course.
but I do want to get into like maybe some case studies or certain scenarios so people can
Absolutely.
go, oh, okay, that's me, or oh, okay, that's my mom, or whatever, and kind of like, and then share that with someone who's like, you could really benefit from this.
Yeah.
How'd you come up with the name?
So, well, Emerald is my birthstone.
Okay, great.
I'm a May baby. I've always loved emeralds.
That's a good one.
It is, isn't it?
Yeah.
Both sides of my family are of Irish descent, and so I've always loved Ireland, and of course they call it the Emerald Isle.
Yeah.
And I just actually got back from a vacation in Ireland just
fun.
a few weeks ago. My dad and my son and I went together, the three of us. So
Had you been before?
my dad and I had.
Okay.
But this was a first for my son.
Okay. You'll have to tell me about that after the podcast.
Yeah, it'll be great. It'll be great. It was eventful, I'll tell you.
All right.
So I love emeralds. I love the color green. And then when I was researching it, I looked up what do emeralds symbolize, and they actually symbolize emotional equilibrium.
What?
And I thought,
Perfect fit.
Well, if that isn't just the most perfect name, I have to do it.
Yep.
So that's how I came up with it.
Okay, great.
Yeah.
So do you want to get into how you decided to choose this field?
Sure.
Let's do that.
Yeah,
and
I'd be
then
happy to.
you're a Kansas City native?
I am.
Okay,
I am
great.
Kansas City native. Yeah, born and raised in Olathe.
Okay.
I live in Prairie Village now, but I've lived kind of all over briefly, I've around the country, but I consider Kansas City my home.
Okay.
So therapy, my career as a therapist, which is also called counseling, or, some people say they're counselors, some people say they're therapist. I just say therapist.
Okay.
But anyway, this was not something that I did right out of college or had any interest in. I didn't go to therapy myself for the first time until I was in my mid-20s.
Okay.
And it was to deal with identity of, like, who am I? What do I want in this world? And then a lot of anxiety. So I when I describe my anxiety, just my baseline is if you put your car in park and you hit the gas and the RPMs go up super high, that's my baseline.
Oh, fun.
So, right. So,
and I am an anxiety person as well.
Okay.
So
I just
love
run
this
high
topic.
on the anxiety scale. Right. So, I love medications for that. I
Yep.
love other, body-based things. I am not shy to say that I'm not embarrassed to say that I am on Lexapro, and it keeps me feeling completely like myself.
And I will say I'm on
love it.
Cymbalta.
Great. Excellent.
Yeah.
So, so in my 20s, I went to therapy for the first time and really enjoyed my therapist, and had been going, through my 20s and 30s. But in my 20s, I was doing something completely different. I was working nonprofit.
Okay.
I did fundraising. I was a grant writer. I was doing all of this other stuff. And this is what happens when you graduate with a bachelor's degree in history and English. You're not exactly marketable. So you just find a job where you find a job.
Yeah.
So anyway, I got married in my mid to late 20s. My ex-husband and I had our son when I was in my mid 30s. And then I stayed at home with my son for a decade.
Oh, okay.
Yeah. And then as he got older, I kind of figured, I need to figure out what I need to do, what I want to do, what's going to be super fulfilling for me.
Yeah.
And oddly, I had several people within about a year tell me, you might want to consider going into therapy, like not going to therapy, but becoming a therapist.
What do you think made them say that? What did they know about you or seeing you?
That's a good question. I think I've always been a person who people feel comfortable talking to about how they feel. I'm not judging anybody for anything. I'm very empathetic. And maybe that was
And
what
even
people
talking
saw.
to you, there's like a soothing, very peaceful, calm element.
Oh, well, nice.
So there could be that too.
Am I fostering emotional equilibrium here?
Yes, absolutely. And hopefully I am too.
Good. It's the green. It's the green. So maybe that was part of it.
Sure.
And when I started thinking about it, it really hit, because one of the things I'd really enjoyed doing when I was still a stay-at-home mom was I would occasionally substitute teach. And I loved it.
Really?
Yes. And I don't particularly care for young kids, but I was substitute teaching little kids and I just loved it. I thought it was so fun. So I really enjoyed the teaching aspect and helping.
Yeah.
And if I were good at science or biology, I might be in medicine because I like the helping aspect. So I thought about it. I researched some programs, some counseling programs around town. And then I spoke to my own former therapist who had gone to UMKC and gotten her Master's of Arts in Counseling. And when I researched that program, it felt like the right fit for me.
Yeah.
And so that's what I did. So I applied, I got in, and I did part-time. So it took me about 3.5 years.
Okay.
So you go through the coursework of that master's, and then you do a practicum, and then you do an internship, and then you pass your exam, and you have to get all of the hours and all of that kind of stuff. And then you get to go to work.
Yep.
And so the minute I started the coursework, I completely fell in love with it. It's just the most fascinating thing to figure out why we are the way we are. I love that.
There's so much to learn.
So much to learn. And I also, I love people. I really enjoy people. I'm an extrovert. I will suck the energy out of a room immediately. I love talking to people.
Yeah.
I think people are so interesting. So really figuring out why we tick, why we are the way we are was just an absolute 100% A+ fit for me. It landed perfectly.
You just knew the whole time.
And then when I started doing my practicum and internship, amazing. It's just the most fulfilling job. I absolutely love what I do, and I love my job. I can't imagine.
And so great to hear, because not
I love
everybody gets to have that privilege in life.
No, they don't. And I'm so lucky to have it. And I also want to acknowledge that it's incredibly difficult work because I sit with people every day. I don't get to see people on their best days.
Right.
I see people in their worst times, and that can weigh on someone. And there's a lot of compassion fatigue and burnout and vicarious trauma that therapists and clinicians experience daily. And so we as a community of therapists really have to remember that and take steps to really take care of ourselves.
So you're based here. People come in and see you. Do you do any kind of virtual?
I do.
Okay,
yes.
Good to know.
Yep, I do virtual.
So kind of walk us through, like, what is a typical day like for you? What all is happening kind of behind the scenes? And then we'll obviously get into EMDR specifically, because that's really what I'm wanting to learn about. But what does kind of a typical day or week look like for you?
Sure. Typical day, typical week. It kind of depends. In the summertime, I don't teach. In the fall, I teach a course called Intro to Guidance and Counseling for undergrads at Park University. In the spring, I teach positive psychology.
Ooh.
Oh, I know. It's so good.
Do we get into that later?
Oh, do you want to?
Yes.
Okay.
I want to know all the things.
Oh, I love it. It's so good.
Okay.
So I teach fall and spring, and that's on Tuesdays and Thursdays in the mornings. So in the mornings on Tuesdays and Thursdays, that's what I'm doing. I'm up in Parkville.
Got it.
Then I will go into the office and have clients the rest of the day, usually. Same with everything else on Monday, Wednesday, Friday. I do work. I work a lot. I like my job a lot, and I work a lot. I work a lot of Saturdays.
Okay.
But I try to limit my Saturday appointments just so I can have some semblance of a real life. And when I'm doing clients, I try to stagger them. They're 50 minutes long, 50 to 60 minutes long.
Okay.
I try to give myself half hour between each one if I can. Sometimes that doesn't work with scheduling.
To kind of decompress, to kind of take notes, to
decompress, to scroll on social media, to go get myself a Diet Dr. Pepper.
Get ready for the next.
Yeah, exactly. To get a bite to eat, something like that.
Yeah.
I'm very lucky because I own my own business, so I set my own schedule.
Yes.
So when I want to travel, I just travel.
Pick up and go.
I can easily, I don't have to clear it with anybody, and that's an absolute privilege, and I understand how lucky I am about that.
Ditto. I love that too.
Oh, it's amazing. It's a huge benefit of being self-employed, but I also understand not everybody can do that. So typical day, typical week, that's what it looks like. Just clients, they come in. Most of my work, I'd say 80% of my work, 85% is in person.
Okay. Are most people coming in, before we get into what exactly EMDR is, are most people coming in on a recurring basis?
Yes.
Okay.
Yes. I don't really specialize in solution-based therapy, which is shorter term.
Okay.
I do think a lot of community organizations excel in that. I don't. I'm more of someone will come into me for.
Do you have a couch? I guess is the question.
Of course.
That is not a myth. That is yes, there's a couch waiting for you.
100% I have a couch, and it's comfortable, but it may not be the most comfortable. I don't know. I've been considering redecorating to have a more comfortable couch.
Love it.
But yes, I have very soothing colors in my office.
Perfect.
It's very therapist-y. It's very therapist-y. Yes, absolutely.
Okay, so EMDR.
Yes.
How
EMDR.
long has EMDR been around? Because I feel like it is more of a people are hearing about it more. And I will use myself as an example. So when we were chatting, I was telling you that I have a friend who went through something extremely difficult, married with kids, and she ended up utilizing EMDR. And so we've talked about it, and I've never been through it myself. So I want to know, like, when did it come around? Has it become more, I don't know what the right word would be, prevalent, popular, as of today,
Yeah, it's a great question. And I'm sorry about your friend experiencing what she did. So EMDR, and at this point, we are talking straight trauma. EMDR is a trauma processing therapy. It's a technique that was kind of invented in 1987.
Okay.
So it's been around a really long time, but I think because of social media and because of more trainings and accessibility to it, it's become more popular in the last maybe 5-10 years. We're hearing about it more.
Yeah. And I should note too, I've had multiple people within my sphere who, friend of a friend, family member, have gone through it.
Oh,
and so that's where I become so intrigued to get the word out, because everybody that I know who's been through it has said it's been the best decision they ever made.
God, I love
so
hearing that.
that's why you're here, so we can get the word out with
Fantastic.
you in case
I can talk about this for how many hours do I have? How many days can I talk
nerd
to you
out about it, right?
Oh my God, I'm going to geek out so hard. Okay. So EMDR was created by a woman named Francine Shapiro in 1987. EMDR stands for Eye Movement Desensitization and Reprocessing Therapy. What she noticed was when she was on a walk one day, the bilateral stimulation, meaning left foot, right foot, left foot, right foot, was helping reduce the distress that she felt, her distressing emotions. So she thought about it, and EMDR was created. And the eye movement piece comes in because if we're doing this, which like this.
Right.
And for people who are listening, I'm moving my eyeballs back and forth without moving my head. But if you're moving your eyeballs back and forth, it's bilateral stimulation the same way you do when you're walking.
Okay.
So that's why when we go for a walk, for instance, we feel better because our eyes are going back and forth, our bodies are going back and forth, left and right. What that does is it processes emotions that get stuck up in our brain and it releases them through our body. So EMDR has become probably the gold standard, I would say, of trauma processing. And it's from PTSD to, it can be used for complex PTSD as well. It's for traumatic events. It's for big T trauma. It's for little t trauma. It's incredibly useful. Okay. So back in the old days, and some clinicians still do this, and I'll do it for the camera, but they would use their two fingers and pretend you're my client and I'm doing this.
Okay.
We would do a session over and over, and I would control this, but I would have you watch my fingers. And there's some talk therapy that goes into it. I mean, not necessarily processing, but, I want you to think of the image or the belief, the feeling, the distress, the disturbance in your body. There's a process. There's a lot of protocol. So you're not just winging it, right?
Yeah.
There's a lot of protocol. There's a lot of training that goes in.
I'm sure.
To being EMDR-trained. So this is how it started.
Okay.
Right? And this would help process, and I'll talk to you more about the trauma piece and how it gets stuck and reprocessed. This is the mode of how it used to happen.
Okay.
Then people were noticing a lot of therapists were getting shoulder and elbow issues because of the repetitive movement.
Oh.
And so then they created a light bar, which it looks kind of like a sound bar, on your TV, and it would, and you would follow the lights on the light bar.
Okay.
So that's a method. People still use those.
Okay.
I use Buzzies. I should have brought them in. I did EMDR today on a client, actually.
Well, when I put this out there, I'll share something maybe that you have that you can give to me.
That would be great. So now...
Or people should just go in and experience it.
Well, they should. They should just come in and make an appointment with me. So now I use Buzzies, and it's a buzzer in one hand and a buzzer in another. And I control it via an app. It's via Bluetooth.
Okay.
It's very high tech now.
Yeah.
And it just... on alternating hands. I control the speed and the intensity. And we walk through the protocol. We're trying to reprocess a memory, or a core belief, a negative core belief, whatever. And that's the mode. And there's also a way to do it virtually, which is very cool. You can do
I have a friend who did it virtually during COVID.
Yes, perfect. Yes. And that is a very easy way to do it. I've done it virtually as well with clients. So, so ultimately, what happens in EMDR is if you can picture, like, if this is a cross section of my brain, of a brain, we've got, let's say this is the frontal lobe, right here. This is the last part of our brain.
What's the age? I'm curious.
So
did this just change?
It did a little bit. It just increased. For women, I'm hearing 26.
Okay.
For men, 28.
Where it's fully developed.
Where it's fully developed.
Which I feel like I never heard about this until like the last year.
No. And this is what's so brilliant about this profession is we are learning more and more every day.
Yeah.
So what I'm telling you today could be completely obsolete in 2 years.
Sure.
Which is great. So have me on in 2 years.
Yeah, because it's always moving forward.
Yes, it's always moving. And we have so much research. There are so many studies that are constantly being done. It's fantastic. So we know now, it used to be 25. Oh, your frontal lobe doesn't develop until you're 25. Well, it's probably a little later, but some people's might be developed earlier. It's
Can
an
we just
average.
talk about like why that's important to know?
Oh, yeah.
Like what exactly does it mean for people who haven't heard that if you're a female at the age of 26, it's finally fully developed? What does that mean?
Yeah. Well, what it means is your frontal lobe is responsible for reasonableness, rational decision making, regulation. Like if something happens and you see something, you're not going to react immediately if you have a healthy frontal lobe and no major history of trauma. If we think about how a 15-year-old might react to something versus a 30-year-old, a 30-year-old likely is going to be, on average, have more perspective.
Sure.
That's what happens with the reasonableness and the frontal lobe. Men are a little later, according to the recent research of it developing. And it's honestly why we all make really stupid decisions when we're in high school and college.
Right.
Right? We look back at it and we
That
think,
explains it.
how am I
It's not
alive?
my fault.
What did, oh my God, no, it wasn't our fault.
Nature.
Yes, it absolutely was nature.
Literally.
It is literally nature.
Yeah.
So our frontal lobe is the part of our brain that is responsible for figuring out whether or not we're actually in danger.
Okay.
Right? That's the last part of the puzzle of our brain that gets formed. Now, our amygdala, which is, let's just say it's over here. So frontal lobe, our amygdala over here is mature at birth. This part of our brain.
How different. How varying. Yeah.
So when we are born, the amygdala in our brain is mature. It doesn't need to develop anymore. It already knows exactly what it needs to know in order to function. The function that the amygdala has is file keeper. It's a huge file cabinet. It's a memory keeper.
Is it true that every memory is stored? It's just a matter of... Okay.
Yes. Pre-verbal memory, pre-conscious memory. Like people will come in and say, I swear I have a memory from when I was 2 years old. I believe that. I believe that. I mean, I don't have a memory from when I was 2, but I'm not them. So yes, it will remember pretty much everything. And most of these memories don't need to be recalled.
Sure.
We can just forget them because they weren't important or they weren't instrumental in our development or in our life or something like that. But that is the file keeper.
But the point is they can be recalled, and that is how you're getting into the undoing or processing getting through.
Everything that has ever happened is stored up here. Everything good, everything bad, everything in between.
And I just want to add in a side note. I did a breathwork session recently.
Yes.
And in talking to the lead, the instructor, honestly, I did it and I was like, I don't think I have anything luckily like major trauma that I need to address, but I've heard so many positive responses and experiences with it that I want to do it for myself. And she's like, well, you'd be surprised. You know, there have been people that have come in here that ended up coming out or going through it, and a memory was recalled that they had no idea about, that's something that was traumatic for them.
Absolutely.
And it kind of explained like the root of what they were going through today. So like the fact that it could be buried so deep, but it can be released to help you move forward.
It is. And breath work, to your point, is a regulation strategy. It's a technique, like somatic, body-based stuff, is incredibly helpful for trauma processing. It's another mode. It's similar to EMDR in that it's a technique that can help. Okay. EMDR is a gold standard, but it is not the only thing to use with trauma. You know, you don't even have to use EMDR with trauma. Sure. It's just really helpful. Yeah. But that's a great point that, you know, even something you don't consciously remember can get moved. The energy can get moved a little bit. A memory can be triggered. So the amygdala holds on to all of that stuff. Now, let's say something really bad happened. Let's use the most common example is often a war veteran. Okay. Right. So let's say there's a war veteran who was in combat, and they come home, and the fireworks on July 4th triggers something in them that makes them panic, and they duck, and they think they're under attack. So what happens at that moment is the amygdala gets triggered by that sound. Yep. So the memory, the sound of that is what is the trigger. It can be a scent, it can be a smell, it can be a literal memory, it can be a behavior, it can be seeing somebody act a certain way, it can be all kinds of things. So if the amygdala gets triggered, the frontal lobe, your thinking brain, your reasonable brain, I mean, the rational part goes offline. Goes offline. It is buffering. Wi-Fi is out. It is gone. We have no coverage here. So what happens is the amygdala triggers our stress response, our trauma response in our nervous system. So the amygdala triggers fight or flight, freeze or fawn. So the war veteran either goes into fight or flight, which is hyper arousal, or hypoarousal, which is freeze or fawn. Okay. I haven't heard of the latter. Yes. So we'll get into that. Yeah. Okay. So there are 4 basic trauma responses. I call them stress responses. That's an interchangeable term. Sure. Trauma response, stress response. Some people get a little itchy when I say trauma because they seem a bit. It's a little judgy or heavy. Yeah. Right. It's heavy. Like, I don't have trauma. Right. Okay. We'll just say it's a stress response. Okay. It's a body response. Yes. Same. Everybody has stress. Yes. Sure. And everybody has trauma too. Sure. Even if it's not, good point. Even if it's not big T trauma, every single person you see, everybody watching, listening, everyone has experienced some kind of small T trauma. Nobody is immune to it. Nobody is immune to it. We've all been bullied, or we've all had a really bad argument with a partner or a spouse or a best friend. Those are small traumas. Yeah. You know, those can confrontation. Exactly. Yeah. Sure. So when the amygdala gets triggered, it sends the signal down to the nervous system. The nervous system reacts the way that the nervous system has been taught to react, which is often something that we learn and is imprinted historically when we are children, when we're little. So often I'll just use myself as an example. My stress or trauma response is often to freeze or to fawn. That's when I just absolutely feel like withdrawing from the confrontation, avoiding confrontation, procrastinating. The isolation feels safer. So we're doing this, or we're not doing it consciously. Sure. We're doing it because it feels safe. And this is what we learned at some point, is to go away, go be alone, or go whatever. Versus some others who are full-blown fight. Exactly. So fight or flight. And fight and flight doesn't necessarily or always mean like, oh, I'm going to punch this person's face in. That's fight, obviously. If you do feel like fighting, that's a fight response. But it's also competitiveness. It's also control. It's perfectionism.
Back to the high
that's a
achievers
fight. Yes.
that you work a lot with.
That's a fight response.
Okay.
And then flight response is maybe another one that I also resonate with freeze and flight, because anxiety is where flight lives. And so, and since I sort of run high on the anxiety scale, I can find myself in flight probably.
Yeah.
You know, pretty easily if I have some sort of trigger.
And flight means what exactly?
Flight means for safety. I want to get the hell out of here.
Okay.
I'm leaving. I'm exiting this conversation. I am
Literally a departure of some
running
sort.
away.
Physical or
Absolutely.
emotional.
Think about, think about it. If we are out 50,000 years ago living on the savannah, and these are the trauma responses that we were born with, our fight response is not going to come out when we are confronted with a 1,000-pound animal that wants to eat us.
Yeah.
Our flight response will.
Okay.
But our freeze response might come out if we're confronted with something that we can maybe hide from.
Okay.
So we may hide in our cave or in our dwelling if something is hunting us.
Okay.
Right.
Yep.
So if we think about it, it's base instinct. It is absolute. Just how am I going to stay safe? How am I going to survive? And
this is all based on how you individually, however you grew up, whatever happened, it was instilled at that point.
Yeah, I think a lot of it is imprinted on us. A lot of us just, we learn from how we're taught. A lot of it is, generational.
I know, which is so interesting to me because I've listened to so many podcasts about talking about like the literal physical, like how it makes its way from the grandmother to the mother to the daughter or whatever.
There are
which is wild.
A million books on the
about.
topic, and it's so fascinating. The generational trauma versus epigenetics, and how epigenetics is the theory of here's a response where a chemical tag, gets turned on by an experience or turned off by an experience, and that leads us down a different. It's the most fascinating stuff. So
we'll have to do like a 2.0.
Oh, can we?
Yeah,
oh my gosh,
absolutely.
I would absolutely love it. Yes, I mean, I could talk about trauma all day long.
Yeah.
Which makes me super fun at parties. Let me tell you.
Oh.
I'm always like, look,
I'm sure you have some great. No, you probably have such like insightful conversations.
I don't know.
Absolutely.
I'm probably a huge bore. It's fine. It's fine.
We'll go out after this and then I'll report back. So.
Okay, awesome. That sounds great. I'm actually, I can be fun. I can be fun, I promise.
I love it.
So anyway, so back to EMDR, if a war veteran came in and said, I felt myself get triggered after hearing fireworks, then what they would work on, a therapist would work on, is how do we reprocess that trauma and those memories that are stored in the amygdala so that they can break apart a little bit and not cause the bodily disturbance that it causes him, his stress reaction. That's the whole point of EMDR, is to relieve the bodily disturbance.
Okay.
That's really what the benefit of EMDR is. We get stuck in trauma, and if it happens at certain ages, when it happens is kind of where we get stuck in the way that we deal with it.
Yeah.
So if I have clients who have been abused in a number of ways, right, in childhood, and sometimes their stress responses don't match up to their adult age. Sometimes it feels like I feel like a little kid. Well, it's because that happened to you, and that memory is a 7-year-old's memory. It's not a 40-year-old memory.
Right. That's what's kind of resurfacing. Can you, just for people to know, like, if this is for them or whatever, like, what are, you said the big T?
Big T trauma.
Big T trauma. Can you give us more examples of what those would be for people to know?
Absolutely. So big T trauma would be combat, a really terrible accident, assault, things like that. Little T trauma would be more like getting bullied.
Okay.
Arguments with a friend, a stressful boss.
Okay.
Things that are maybe not, well, let me think. I'm trying to think of a way to say it that doesn't sound minimizing, because
Sure.
those things are serious. I was going to say not
And
as
maybe
serious.
maybe even without categorizing them, just knowing
Yeah.
like, suicide is
Big T.
a big T.
Big T. Murder, big T.
Yep.
Sexual assault, big T. If a random attack,
I
big
mean, the
T.
country
School
that we
shootings,
live in,
big
shootings,
T.
terrorism, yeah,
Yes,
any of it.
big T
Yeah.
everywhere. We're living through a lot of trauma.
Yeah.
And that's the other thing is that the series of little T traumas that we go through all the time is can add up and be as serious, if not more so,
Yeah.
than one big trauma that we experience. So
Yeah.
we can't underestimate how complex PTSD shows up as well.
Yeah.
And so PTSD is different than complex PTSD.
Okay.
In that PTSD is one event. A war veteran has PTSD. Complex PTSD is someone who grew up in an emotionally neglectful home,
Yeah.
or someone who was abused in a marriage, was married to a narcissist for 40 years or 10 years or whatever, and was abused emotionally. That's complex PTSD.
Yeah.
Complex PTSD can be worked through in a number of ways. EMDR is one of them, but I don't know if it's indicated as the number one to
Yeah.
use for complex.
Sure.
PTSD, absolutely EMDR.
Okay.
is a
It's just
winner.
interesting to hear, to like cite examples, because even just then I had a thought of, you mentioned a boss, and I was like,
Oh,
I
yes.
definitely have had a boss historically who was, when it was great, when it was good, it was great, when it was bad, it was torture kind of
gosh.
thing, and I still to this day, I'm like, I wonder how much of my 20-year-old 20-something self is like still impacted to this day.
I would suspect a lot of
Yeah.
it, because we're still very impressionable at that age. And if it
Yeah.
was one of your first work experiences in the professional world, or first bosses, that can really lay the groundwork
Yep.
for how we envision what working looks like. And then we get into our fight
Yeah.
or flight, or our freeze or fawn
Yeah.
responses. So.
Well, and I just want to add too, just candidly going through the breathworks thing, the thing that I kind of, and I would love for her to come on the podcast to talk about like that with me too. The thing that I kind of discovered in short was kind of going back and realizing sort of a self-worth question for myself, which
Absolutely.
now I'm connecting the dots back to a self-worth thing that could be associated with my experience with him and how that has impacted me, 20 years moving forward, and what I've done professionally, So it's
Absolutely.
really interesting just to kind of tie it all together.
That is interesting. And to tie it even more tightly, the belief system there is really important in EMDR work. And so I have a number of clients who come in who talk about worthiness, or I have to be perfect, or I'm not good enough. And they have this negative core belief. And that can also be something that we work on as an EMDR target.
Okay.
So it doesn't have to be some major, car accident or
Yeah.
major trauma. It can be this belief of, I should have done.
Imposter syndrome.
I should have known better. Mine. So when I did EMDR,
That's what I was going to. So
Yes.
you've been through it.
I have.
Obviously.
Yes.
Since you are leading this.
yes. So my, we kind of joked around about in my EMDR training about, we all kind of found our golden thread of trauma.
Yeah.
And what that belief is in our brains. And for me, I can trace everything back, everything that makes me feel like, God, what a terrible memory, or the bodily
Sure.
disturbance,
A little bit of a cringe.
Yes, the cringe
Ugh.
stuff. I
Yeah.
can trace every single trauma back to, I should have known better. I should have known better. And so it's those should haves where, you can't should yourself to death,
Right.
because you will.
Yeah.
But I should have known better. And so that's a core belief. We've got beliefs that relate to control, where I have to be perfect. There's worthiness. There's
I have to be the best. I have to
be the
win.
best.
I have to.
I won't be loved.
Yeah.
I won't be accepted until I'm the best. Those kinds of things. That's what most of my EMDR clientele work on, are these core beliefs.
Are you seeing more of that in the world of social media and the world of everybody has to be beautiful because that's what everybody looks like, and everybody has to be rich because that's what you see? And yeah.
Yeah, there's definitely a lot of that. There's, oh gosh, yeah. And not even in EMDR, but just in therapy in general. The standards of of beauty, of youth.
Yeah.
You know, where I'm 48 and I've living my best life. You know, I love aging. I absolutely love it. And I also look in the mirror and think, wait a minute, should I get more Botox?
Yep. Yeah. Every day.
Yeah. And I wonder that. And then I have to go back and then I cannot have a conversation, Mindy, without talking about patriarchy. I'm so sorry. But
go for it.
And white supremacy. I do it all the time.
Do it.
So those are white supremacist patriarchal beauty standards.
Yeah.
And that's ridiculous. Mm-hmm. I mean, look at everything. Look at what we have to offer the world, all of us, right? And we're basing our worth on whether or not I have 11s right here. It's insane.
And we're all, I mean, you can't generalize, but we're all impacted by that.
All of us.
Whether we realize it or not.
All of us.
Or whether we maybe attribute it to that or not.
Absolutely. Yeah. And we all have internalized misogyny and internalized biases and all of these things. And so I obviously have to have I can't have a conversation.
You can say whatever you want. This is an open book.
This is why I'm super fun at parties where I'm like, well, let's talk about patriarchy
I feel like
and white
that's kind
supremacy.
of a common topic that a lot of people, I can tell you a lot of my friends do end up talking about
good.
that. So.
Okay, good. Well, I'll come to one of your parties and I'll just
come on over. Yeah. I love it.
Yeah.
I love it.
So, but yes, to circle back to your question, I do see a lot of people kind of wondering about their identity and who am I if I'm not 25 and beautiful?
Yep.
Am I worthy? Am I important? You know, what do I have to offer?
Yeah.
And that sort of thing.
So okay, so with EMDR, let's just say someone comes in, you do a consultation, obviously to understand what they're there for. And then do you go into, like, kind of walk me through, I guess, what it's like. I don't even know how to ask this. Like, so you do, how does the eye thing, I mean, obviously you're not going to do it here. It's not going to work, you know, but like, how do you walk somebody through that? You're with them for 50 minutes.
Yep.
Do you do it weekly until somebody feels like they've achieved a breakthrough? Or what does that look like?
Great question. Yeah. So first, I always offer a free consultation for everybody, just so they can see whether or not they like my vibe, if I'm going to be a good fit for them. And if they choose to move forward with me, then we start with an intake. That's the very first session. I like to schedule those for 90 minutes. That's the longest session that we'll ever have, but I get all of the background information. I ask every question you could possibly ask in an intake, and kind of get what they're looking to accomplish. Like, what are their goals? What are they wanting to do?
Yeah.
And if EMDR is something that they're wanting to do, I would probably do a couple more just regular sessions with them prior to EMDR in order to establish good rapport, make sure they felt that they were safe, that they trusted me, and that they knew what the process looked like.
Because that's going to allow somebody to feel like they can completely break down their barriers and get the most out of that.
Exactly.
So that's important.
And I also think that most of my clients who do EMDR have been with me longer than 6 months before they even do EMDR.
Okay.
Yeah.
Do a lot of people come to you for counseling or therapy and then realize that EMDR? Okay.
Definitely.
Got it.
Yeah. We most of them do, in fact.
Okay.
I've had a couple of people who have come in with more acute issues. I had one client come in who was attacked by a dog, and it was really disrupting their daily life. And so we did EMDR through that to work through that, which was super helpful.
Yeah.
And also this client also said, well, I kind of like to work through some other stuff too. And so there are...
While we're at it, let's just get to work.
Right? While I'm here.
Yeah.
But yeah, I would say that most people who come in don't really know why they're coming in.
Okay.
A lot of times
I like to hear that, though, because I think that would apply to so many people who are like, I'm feeling something and I'm unsure of what to identify.
And I don't know what it is. And I get that a lot from men too, or men will come in and say, you know, my wife says I have to come to counseling because something's going on with me and I don't know what it is and she doesn't know what it is. And so then we're able to sort of, look at their experiences and what happened and what's going on. There's nothing wrong with you, just what happened, what happened in your life. And so then if we determine EMDR is a good fit, and I do psychoeducation, which is one of my favorite things, is teaching clients about, methods and, modalities and techniques.
Yeah.
If they determine, yeah, that sounds like a good idea, then what I would do is use a session to prep them, which answers all of their questions about the EMDR process. I tell them exactly what I will do.
Can you kind of give us an example? Yeah, walk through that. Yeah.
So first, what I would want to do with them is to resource them, which is to make sure that they have the skills necessary that if after an EMDR session, they go home and they get triggered, they can regulate themselves.
Okay.
So I want to make sure they have those skills. So we do that in that session. And then I tell them exactly what we do. So I need to, let's just pretend. So, so we're going to do EMDR, Mindy. So what we're going to do is we're going to identify the negative core belief that you feel you have, that you somewhere in here, even though it may not be logical, you still feel, you still believe
kind of haunts me.
About
yourself.
Yourself.
It's like a self-worth thing.
Perfect.
Kind of haunts me.
Yeah, that's a great one because that's, I think that's universal for a lot of people. So, so the negative core belief, Mindy, sounds like, I am not worthy or I am unworthy. And you would say, yeah, that fits. And if it didn't fit, we'd find the right wording until it did.
Sure.
And then I would say, if we're doing it just very general, like this is the belief that I have about myself.
Versus like an incident I was bullied that I've held on to. Okay.
Bingo. Yeah. Because there's that type of EMDR, which is contained dog attack client.
Okay.
That's contained reprocessing. But if it's a core belief of I am not worthy of X, Y, and Z, or I'm not worthy of love, let's use that.
Yeah.
Or I have to be perfect. That is a more universal belief in your body and permeates probably more of your existence.
Yeah.
So then I would use regular EMDR.
Okay.
So no containment on that.
Got it.
So what I would say is, can you come up with a picture or an image or even a specific memory of when you felt like you weren't worthy. And so you would do that and you would tell me about that. And we would have that as kind of a still frame image. Then we would find what you want to believe about yourself someday. Maybe it's probably not going to be after one session today, but someday, I think I want to feel I am perfect just as I am. That's the core belief that I really want to feel about myself. Great. So we have that. So then I do a couple of scaling questions, which is on a scale of this to this. How true does this feel? On a scale of this to this, how disturbing does this feel when you bring up this memory? Where do you feel it in your body? Okay, we have all of that. Okay, so then I would say...
Where are people feeling? Just head, heart?
Most people, so the client I did today, EMDR with, she felt it in her chest.
Okay.
And it felt tight and panicky for her. A lot of times it'll be in the throat.
Okay.
It'll be sadness. It'll be grief. It'll be anxiety in the stomach, tension in shoulders. That's a lot of high performance, lots of pressure. I have a lot of high achieving clients, and they often feel it, just a weightiness in their shoulders. So it's all over. Hips, sometimes with sexual assault. Okay. They'll feel pain in their midsection or hips. Okay. So it can be it can be anywhere.
Okay.
And so once we kind of fill out all of that basic information, then I explain the process of, here are these two Buzzies. You're going to hold them in your hands. You're just going to sit on my couch. For people who do eye movement, the eye movement mode, they're either having a therapist do this, or they'll have a light bar where they'll sit in front of the light bar and they'll just watch the light go back and forth, back and forth.
And did you say you do that, or you're doing the Buzzies?
I do the Buzzies.
Okay,
yeah.
good to know.
But I do like the light bar, and I love the virtual option that's online, that they follow a little dot on a screen that the therapist controls the speed of. And so
so even though it's eye movement, it has progressed into just really this kind of balance, like back and forth. Okay.
Exactly. And it's the bilateral stimulation. So that means side by side, not at the same time.
Got it.
So it's, right, left, right, left.
Okay.
And if you don't have any of the technology, that's okay too. Some therapists use this
Okay.
Which is a quick like butterfly hug. This is the same. It gives the same thing.
Got it.
It's crossing the midline. It all works out to be the same.
Okay.
Same thing.
Interesting.
So I would hand you the Buzzies. I'd give you a little test of like, here's how it feels. You know, does that feel okay? Some people may have a texture issue, where because these Buzzies that I have are kind of they're soft.
Okay.
I don't know what the material is, but you may have to cut this part out. It's kind of like
That's okay.
those buttons, you know?
Okay.
I don't know what that, rubbery maybe?
Sure.
And some people have texture issues.
Yeah.
If they do, okay, then we'll pivot and we'll do something else.
Okay.
Okay, so I give you the Buzzies. I say, here's how it's going to go. I'm going to have you hold that image that you came up with and that negative core belief. And then I'm going to have you kind of close your eyes and I'm going to start the Buzzies. And you're just going to let your brain do what your brain wants to do. And I will stop the Buzzies after, since I'm letting you go a little bit longer. It's not contained. And every time I stop the Buzzies, I will say, okay, take a breath, which just means come back to me for a second. What do you notice? Okay. And then all you would do is say, well, I am noticing either a feeling, a memory. It could be a different image. It could be for some reason, I'm picturing a TV show I watched when I was 9 years old. Great. You don't have to process any of it. You don't talk about any of that. I just say, go with that.
Okay.
And I start the Buzzy again. And we do that over and over and over again.
Okay.
And I watch how many seconds the Buzzies are going. I watch your body cues to see how you're reacting to it. If there's bodily distress, if I can usually tell if something comes up, if emotion comes up. It's very common for people to feel emotional during.
Are people closing their eyes? Are they open? Is it whatever you feel?
It's whatever you feel.
Okay.
Yeah. When you do eye movement, the actual finger movement, certainly your eyes are open.
Yeah.
So that's different.
Yeah.
For Buzzies, I would say all but one or two of my clients will close them.
I would think so.
Yeah.
I feel like that would give you more opportunity for these, visions, memories.
The images to go through.
Without
and so,
distraction.
Yeah. And so we just do that. And I keep an eye on time. And when we're kind of closing out, I'll let them know. People can stop at any time. You know, if you felt super distressed, if you hated the process, if you wanted to quit, you're in control. The brain is going to do what the brain is going to do. And the whole point of this is to feel better. The brain wants to heal. So does the body. We're just trying to get it to process.
So when these memories or, images or whatever come up, is that part of the process of like release? It's like pulling the file out so it can be released and you can move on?
It's opening the file and just sort of like scattering all of the paperwork out of the file. Yeah, some decluttering. Okay. And then it kind of breaks apart a little bit. That's how I imagine it. That's how it felt for me. Yeah. Is that it broke apart and it gave me room.
Okay.
It created space for me. And I thought,
that's helpful.
Oh my gosh, what a relief. Yeah.
Okay.
The challenge with it is also that sometimes the universe loves a vacuum, right? So it'll fill it. Or universe doesn't love a vacuum. Anyway, the vacuum gets filled. That memory.
I love a vacuum. I don't know what that says, but.
So oftentimes a client will say, well, something else came up. A different memory or something else. And that's very normal.
Something unrelated,
yes,
maybe.
It's kind of like whack-a-mole.
Yeah.
Or Jenga. In training, they talk about you can envision it as a Jenga block.
Okay.
And like you're taking out this Jenga block, but if you don't add another one in there, it might topple. So
is it breaking it apart to release it because a lot of the individuals that you're working with have chosen to not face that visual? Like they've pushed it so far back that now you're asking them to reconnect with it so you can move it out.
Kind of confront it a little bit.
Yeah.
Sometimes, yes. Sometimes, avoidance is a great and brilliant coping strategy. It keeps us safe.
Which could be scary.
Very.
But very obviously therapeutic in this case. Yeah.
Incredibly therapeutic. So if somebody is, and especially if it's behavior that feels scary, or if they feel like they're going to get judged, or if they feel shame around, they're less likely to just want to talk about it and bring it up. And so the processing of it really, in my clients' experiences, I think I could probably say allows them to feel more compassion for themselves in the moment. And it becomes less of a burden and less heavy to carry around. And then in turn, it doesn't create the bodily disturbance that guilt or shame or anger or fear may cause us.
So let's go back to the veteran.
Please.
And the 4th of July, the firework, which is right around the time that we're at right now.
That's
and
exactly right.
I think many of us know that we have neighborhood groups that people complain and people get mad when they complain that they can't do the fireworks, but there are real traumatic issues that we're overlooking. So with a veteran, he's opening up the file and this experience in war of that noise comes out essentially. And then moving forward, how can you kind of help me understand like how he would be less triggered by it? Like what exactly is happening that he can hear it again the next year and not be bothered? Is it the release? Is it confrontation?
Partially. And it's also learning more regulation skills.
Okay.
So that when he feels that trigger, because nobody ever stops being triggered.
Right.
I mean, until we're dead, we're going to be triggered by all kinds of things. So it's not that he's going to stop feeling that trigger or noticing that trigger, but he's going to have more space between the immediate reaction that he's having now, where his amygdala sends the fight or flight or freeze or fawn response immediately. There's going to be a little bit more space for him, which is called the window of tolerance. Okay. So there's this thing called that we all have, window of tolerance. Just picture it like a little window pane. And everything we can tolerate is in this window, right? So even if it's at the corners, we're still okay. We're feeling a little okay. But basically, we're okay if we're all in this window of tolerance. This is when we're regulated. Right now, you and I are regulated. We're in our window of tolerance. Right. People who experience trauma, like the veteran, have trauma creates a smaller, tighter window. So their ability to experience trauma or those triggers isn't nearly as wide as maybe it was pre-war or prior to that experience. Right. So what EMDR can do is sort of expand that window a little bit so that the person who is getting EMDR can recognize, ooh, I'm feeling activated, but I'm not immediately hitting the floor to hide. What this is it's fireworks, it's 4th of July. I'm going to regulate myself. I'm going to do body work. I'm going to do breath work. I'm going to call my best friend. I'm going to go for a run. I'm going to do something body, physiological, psychological, something to regulate. Part of that regulation. Right. Got it. Yeah. It's a 2-step kind of thing where we have to add in the regulation. We have to learn those skills so that our body gets used to working through, because stress happens and our stress response needs to have a completion. Our stress cycle has to have a completion. Right. And so that can help.
Have you ever had anybody make it out in one session and just go, whoop?
Actually, I have. Really? Yes. People who are extremely quick processors. Myself, I'm a really fast processor, but probably because I'm a therapist. Sure. And I'll talk about feelings and all of that for ever. So people who are super fast processors can find relief in a session. Okay. Truly. People who have,
but not the norm.
I wouldn't say it's the norm, and I don't want to put too much pressure on someone.
Yeah, of course.
Too, if they come in and they expect to feel great after one session, I'm like, oh my God. What's wrong with you? Well, absolutely nothing. There's nothing wrong with you. It just may take more than 40 minutes or 50 minutes to work through a lifetime of this core belief. So I have had a client who, within 10 minutes, he was like, oh, I feel so much better.
Great.
But he was a really fast process.
Yeah. So like, and our work is done.
I know. I was like, well, what else you got?
Like a coffee? Yeah.
So, but there are also some other techniques that I've done. One is called critical incident desensitization. Okay. And it's kind of like baby EMDR.
Okay.
And that you can find relief in minutes.
Okay.
Minutes.
Interesting.
Yeah, it's fascinating. That was created for the first responders during Hurricane Katrina.
Oh.
Because they were seeing and experiencing so much devastation and loss of human life and just trauma, and they were getting completely overwhelmed. And so I don't know who, I'd have to check my sources of who created the critical incident desensitization, but it's this as someone talks you through, and it can provide so much relief. I've done it on people for car accident. I did it on my uncle when he was in a car accident.
Is that something he could do on his own, or is it really like you need to be guided by
both? So you can
like you can do it incorrectly.
You could do it. Yeah, you could
okay.
do it incorrectly because you can actually accidentally sort of process trauma right back in.
Oh,
yeah.
Okay,
And you don't want to do
know.
that or but it's also.
I just imagine someone being like, okay, here we go. I'm worthy.
What can work
or whatever.
is if you do it. Oh, sorry, I keep hitting the microphone. What can work is if you do it kind of slowly. That if you with a positive thought, that's tapping in something positive.
Or maybe if somebody's like, I can't get to Katie, I am in a moment of. Is this something they could just do kind of on their own? Would it have any kind of?
They could if they did it low and slow.
Okay,
and
just to be clear,
positive affirmation.
You could overdo it. Okay,
a really beautiful memory with somebody that you love, your kid or your dog or whatever. You can do that as like a soothing kind of thing. Okay. But if you start going fast, you might accidentally bump yourself up into something you don't want to get into.
Which is why you've studied this so much, and you are the one to be doing this, helping
I don't know.
Yeah.
Maybe Google it before you do it.
Yeah.
But this baby EMDR really, is fantastic for quick processing.
Okay, good.
Yeah. So if you can't, get to an EMDR session, this critical incident desensitization can work too.
Well, which maybe that is a good segue into, so I had a chiropractor in here a couple months ago, and we talked about social media, and don't go to social media to crack your back, like you're going to end up injured for life or whatever. What is happening in the world of social media that people, in relation to, EMDR, but maybe anything else that you're like, please, like PSA, steer clear of these random people telling you what to do, if you're seeing any of that?
I have seen some, although I will say there are some really excellent therapist creators out there.
Good to know.
I know a number of them from my own program, so I'm a little biased.
Yeah.
But they are providing good information with appropriate disclaimers.
That's good to know.
They're not providing advice. They're not providing, hey, here's how you do EMDR. You don't do that
on your own.
Right.
Yeah. Okay.
You need somebody who is trained in it. And when it comes to social media, take it with a grain of salt. Check the qualifications. Certainly. Make sure it's not just some rando who decided to read a self-help book and proclaim themselves an expert, right?
Which I'm sure that person's out there.
Of course. And I still feel that way where I'm like, am I even qualified to do what I'm doing? I do.
Back to imposter syndrome. Why do we do that? Yeah.
I don't know. Maybe I need to do EMDR.
You clearly went to school.
I've had the training. I know what I'm doing. But yeah, so I would say just be a conscientious and critical consumer of social media. And that also goes for AI.
Great reminder.
So many people use ChatGPT or other AI models as therapy. And
we've already heard some horror stories about that.
I tell my students this when I teach, because I always have to tell them, don't use AI to write your paper or do your assignments, because I'll know.
Yeah.
And you'll be in trouble.
Well, I would imagine in that case, somebody could literally end up in like a lawsuit someday because they didn't do the actual work to help the human. Yeah,
you would think.
But you would think.
You would think.
Yeah.
Yeah. So it's an echo chamber.
Back to the
frontal lobe. Frontal lobe. Okay. AI can be, anyway, it doesn't matter about my feelings about
That'll
AI.
be a 3.0. No.
Okay. Give me at your next party with a couple of beers or a glass of wine, and I'll just have all kinds of thoughts. It is an echo chamber. Just be wary. It will tell you exactly what you want to hear. And therapy isn't going to do that.
Yeah.
Therapy might hold a mirror up and say, is this really how you want to continue? And that feels a lot different than AI saying, hey, you're doing a great job.
Yep.
You're doing awesome. And you probably are doing a great job.
What you're doing.
Yeah.
Yeah.
But blaming other people.
Yeah.
And, recommending like, well, you should just never talk to that person again, or you should just, cut off your best friend. And it can be very
a little cutthroat, a little extreme.
It gets a little extreme. Yeah.
Yeah.
So,
okay. So you work, do you work with 18 and over?
I do.
Okay.
Yeah.
Is there any reason you decided to do that versus working with kids or under 18? And you don't work with people under 18,
right.
But are there others? Would you recommend it, or do other people recommend EMDR for people that are under the age of 18?
Oh, absolutely. Yes. Okay. So my clients are, I think the youngest client I have is probably 16, as long as I can do talk therapy with him.
Got it.
I am not trained in play therapy. I never took a play therapy class.
Right.
You have to be that's a very different skill set. And I have mad respect for play therapists. They're incredible, incredible people. My interests just aren't that.
Yeah, that's fair.
But EMDR is fantastic for kids.
Okay.
Yeah.
Good.
Yeah.
Good
Kids,
to know.
they use it for kids all the time. There were a number of play therapists in my particular training who were very interested in using it with some of their clients. And so with their kid clients, it can be for any age.
Okay.
The only contraindications, of course, you have to be very careful if someone may have an issue with dissociation. And I mean like actual dissociation, not the dissociation that most of us do where we're just completely zoned out and, scrolling TikTok or binging TV or just staring at a wall.
Just checked out, yeah.
Yeah. What I mean by that is like dissociative identity disorder.
Would that be like schizophrenic or
no? DID is what they used to call, or what they call now, multiple personality disorder.
I see. Okay.
So you have to be very, very careful and have some assessments on that.
Got it.
But most other populations, it can be used really well for anxiety, depression, addictions. ADHD people do great with it. Of course, trauma, obviously, but a lot of different populations, age groups,
addiction.
Gender,
that's an interesting one. Hadn't even thought about that.
Sexuality. Yeah, addiction. Yeah.
Sexuality makes sense. Okay.
Absolutely. Yeah, because think about substance use disorder.
Yeah.
There's something in your mind telling you to keep doing that, keep drinking, keep taking that drug, keep doing it. What is that?
I'm glad you brought that up.
Yeah.
I'm like, what else? What else are, do you have any, like, I don't know, standout examples where you were just like, wow, like the transformation of this client that I had was just something for the books. Do you have anything like that to share, just out of curiosity? And if you don't, it's okay.
Yes, I do. And I think, gosh, I just love all of my clients so much.
And I love that you love it so much. That is huge.
I just love them.
It's like infectious, yeah.
I learn more from my clients than they could ever learn from me.
Oh.
I mean, I'm a big believer in that. They're incredibly wise. They are just so incredibly resilient, and I just love people. I'm an eternal optimist. I always, I think the best of people.
But to be fair, they are a product of what you're helping them to get through too. So it's a reflection of what you're helping them with too.
Maybe, but they're doing the work too, right?
Yeah.
I know.
Yeah.
So, but thank you.
Yes.
I hear what you're saying. Thank you. I'm trying to take a compliment, and it's going to be really hard for me. So I'll work on it.
We're women. That's what we do. We don't take the compliment.
We don't take compliments. What are you talking about?
That could be something we could get into for EMDR. Can't accept the compliment.
That's exactly right. It's exactly right. What's the core belief? I'm not actually as good as everybody thinks I am. Yeah, 100%. So, but yeah, I think I have seen some transformation in a number of clients, mainly in how and I'm thinking of one in particular, and I'll keep her details private.
Of course.
But after an emotionally abusive marriage, she is learning how to conceptualize her experience and her existence with much less judgment on herself. Instead of the, I should have left, why didn't I leave? It's, okay, I see now, I didn't have the resources.
Mm-hmm.
I was kind of stuck,
Yeah.
you know, both physically and emotionally. I didn't have a choice,
Mm-hmm.
you know, and prior to EMDR, I think it was more of, I can't believe how guilty I feel of staying in this marriage. You know, and so I think those are sort of the transformations.
Mm-hmm.
One client also
To find happiness again, right? Like,
Oh,
I feel
yeah.
like that's a big part of maybe that story too, to be
Yeah.
able to find happiness again for a
Yeah.
lot of people who feel like,
and contentment,
And contentment,
right?
yeah.
And recovery and resolution,
yeah,
and to be able to exist
Mm-hmm.
in their bodies and in their lives as themselves and not as traumatized human beings who are just, you know, stuck
Mm-hmm. Yeah.
without being stuck. And that's the thing is, EMDR aside, modality aside, I don't care if people go to a therapist who focuses on CBT or ACT or interpersonal therapy or psychodynamic. It doesn't matter the modality. What matters is, do you have a good rapport with your therapist? If you feel safe, if you feel accepted, and if you feel like you have a good relationship with that therapist, the likelihood is, I can't remember the statistic, my clinical supervisor, bless her, she always says it's like 90%. I don't know, maybe it's 90, even if it's 80, even if it's 70.
Sure.
70%, 80% of these people will find relief. You feel better just by having somebody that you trust.
What an incredible feeling.
It doesn't matter the modality. It really doesn't. It
Yeah.
really matters on the relationship.
Okay.
And I try to impress that upon the kids in the Intro to Guidance and Counseling course
Yeah.
as well, because they're like, well, what theory? Which one's the best one? You know, in undergrad. And I remember thinking that in grad school.
Sure.
Like, what if I pick the wrong theory to focus on? It literally doesn't matter.
Yeah.
As long as you have a good relationship with your therapist and your therapist can sit there and be there in the moment with you,
Yeah.
you will feel better.
Amazing.
You just will.
Yeah.
Yeah.
I love it.
Yeah.
Do you collaborate with any other people? Like, do you refer, like, anyone you want to shout out or that you want to talk about who you kind of work with around KC?
Absolutely. So I will say the greater Kansas City area has a very robust therapy network.
Love it.
And it's fantastic. We're, most of us, I would say, are on the Facebook. There's a private Facebook page
Okay.
for GKC therapists. And it is probably one of the best resources to get information on, hey, I have a client who is experiencing X, Y, and Z. Any referrals, you know, it's not my specialty, but any referrals for this person. And a ton of people will say, oh, this is my specialty. And then you can refer right to these folks.
It's so Kansas City, right?
It's so great.
Love it.
It's such a great resource.
Yeah.
I own my own business. I lease my office space in an office suite with a bunch of other solo practitioners as well.
okay. Yeah.
Many of whom I went to grad school with. And we are all very close. And
Yeah.
so we will say, hey, if we have 10 minutes in the break room or over lunch, hey, question about such and such a modality, or have you noticed this with disordered eating, or what about this with ADHD, or, you know, somatic, you know, and things like that. And it's so great to have
Meeting of the minds,
collaboration
coming together. Yeah.
and just, you know, somebody to bounce things off of.
Mm-hmm.
I will always enjoy consultation groups and consultation meetings. Group supervision is really important when you're still getting your clinical licensure. Same with individual supervision.
Sure.
My clinical supervisor is Renee McCreary. She's been in the game for ever.
Love it.
She's fantastic.
Yeah.
Absolutely. Just her work is anti-racist. Her practice is, she's incredible.
So many good things. Yeah.
Yeah. And so I've had the benefit of just some really incredible supervisory experiences and supervisors. And that's where we learn. That's where we learn. So you bring a question to a supervision meeting and you just think, God, here's this case conceptualization. What do I do?
Yeah.
You know, and I always walk away
Yeah.
with more information.
Yeah.
So Kansas City's a great place. Tons of referrals. Everybody's super friendly.
Yeah.
There are so many great therapists out there.
Yeah.
So even if I'm not the one for you, then you will find the right person. Yeah,
right.
for sure.
Going back to your patients, so and people like who are listening, if there's somebody out there who maybe feels like I have nobody to talk to. I've never told anybody this. I am scared out of my mind to let it come out or to, you know, put it out there or talk to someone. Like, what would you say to them to get them to go, this is kind of like your open door to come in and chat with me, come in, talk with me. Because that's such a fearful thing for them that they've never faced, addressed.
Absolutely. And it is scary to kind of bare your soul to a complete stranger. Mm-hmm. I mean,
sure.
Seems a little, seems really scary.
Yeah.
And I have a lot of clients who have never been to therapy before.
Yeah.
And they come to me and they say, I've never told anybody this,
mm-hmm.
but then they'll tell me, you know, a really deep, dark secret.
Yeah.
And when they do, I always say, thank you so much for telling me that.
Mm-hmm.
I know that took a lot.
Yeah.
And I hope that I can let people know that I am a safe place. My office, what you tell me in my office, as long as you're not going to hurt yourself or hurt someone else, it's going nowhere.
Yeah.
It's in the vault.
Mm-hmm.
It is absolutely safe, and there is no judgment. Mm-hmm. Absolutely no judgment. It's unconditional positive regard, which is one of the skills that we learn in grad school, and I don't know, I try to show up for every client with a real genuine sense of acceptance.
Yeah.
And I am trained in that.
Yeah.
I can handle that hard stuff.
Mm-hmm.
You're not going to scare me away.
Yeah.
I'm not going to think you're a bad person.
Mm-hmm.
Even if you think you did something bad,
Yeah.
or if something bad happened to you, I don't think there's anything wrong with you.
Mm-hmm.
I think that something maybe happened to you, and maybe you would like to feel better. And so I would encourage anybody who maybe is reluctant or nervous to just shop around. Mm-hmm. Go have a virtual consult or a phone call with me or a therapist who you feel like fits your vibe.
Yeah.
And if it feels safe, just try it.
Yeah.
Because the goal for that therapist, hopefully, the goal for me as a therapist is to help you feel better.
Yeah.
That's all I want. Mm-hmm. It's not my agenda. I'm not going to try to make you be somebody else or anything that I just want my clients to feel better. That's the whole point. Mm-hmm. So I would encourage just to take that little step.
Yeah.
Just have a virtual consultation. There's literally no requirement after that. If you decide, nope, don't want to do it, that's okay.
That's up to you.
Try it again later.
Yeah. What else have we not talked about with EMDR that we want to talk about? I know we talked about some things that were like, do you want to get to that? And I can't even remember what they are now.
I should have been taking notes.
I should have been taking notes too. But what else, and I'm going through to make sure I have my notes in here too, but what else have we not talked about that would be super important for people, that this is a new topic to them, a new option to them, that we haven't addressed already?
Yeah, I think with EMDR, it can only be done with somebody who is EMDR-trained.
Okay.
So that's really important to ask your therapist, you know, are you trained in EMDR? Mm-hmm. And even if they're not, they might have a different trauma processing modality that they use or technique that they use. And that's okay too. EMDR isn't the end all be all for every single person. Mm-hmm. If other people want to try something different, that's fine. Yeah. I'm a particular fan of EMDR, but let's see. So make sure they're trained. Ask as many questions about the process. Don't feel shy about asking, I think, is something that I might recommend. Mm-hmm. There's been, I think we talked a little bit about the not resurgence, but more social media about EMDR, more airtime about it. Mm-hmm. There's some other, I don't know, trying to think of anything else that's coming up. Like there's some other trauma processing techniques that are becoming popular as well. Okay. So I think it would be interesting to see how EMDR stacks up to some of the newer stuff. And I only say that because we learn more about the brain and the body and how trauma affects everything.
Yeah.
Every year.
Yeah.
Every year we're learning more and more.
Yeah.
You know, and so,
which is incredible.
Yeah. And it's great. It's great. So, let's see, what else about EMDR? I don't know if I have anything else.
And we covered a lot.
I know.
So we might be good. Yeah. And I can always put stuff out later if you think of it later too. But no, I mean, this has been incredibly insightful for me.
Has it?
Just
I'm so glad.
yeah, like getting into the specifics of like how it actually works, what people are dealing with, you know, things I didn't even think about, you know, addiction being one of them, something like that. A boss, you know.
A boss, yes.
Yeah. There's just so much.
Yeah.
Okay, so how do you decompress after a full day of teaching and working with people? Like, what's your way of kind of pushing the reset button or, you know, taking care of yourself?
Yeah. So I'd say I probably get on TikTok a little too much. That's probably not the best thing for me.
I mean, everybody does. You're in good company.
You know, I might do a little bit too much of that. So I think some of the things that help regulate me and ground me are, I love hanging out with my son, although he's 13 and probably doesn't want to hang out with me nearly as much.
Getting
as
to that point of wanting to go.
He's like, friends. I'm good, Mom.
Yeah.
I'm all set. I'm gonna go. I'm like, okay. But my friends, you know, my girlfriends are my absolute lifelines. I have such wonderful friends.
Love that.
They are just incredible,
so important in life.
Incredible
good people around you.
Wonderful women. I just love them so much. Yeah. They keep me very grounded and they help me regulate a lot. And so I'm able to do that with them, which is great. I'd like to travel, so I always have a trip planned.
Perfect.
Yeah, I love
speaking my language.
Yes, I always have a trip planned.
Yeah.
I just have to. There's so much to explore. There's so many people to meet.
Oh, I know.
There's so many people I want to talk to. So all around the world. So I like to travel. And I just, lately, I've been a real homebody, which is kind of interesting. It's been a change in the last few years, becoming kind of a homebody when I used to really like to go out a lot. I still like to go out.
Perimenopause?
But yeah, I think so. I do think it's perimenopause. I do. I'll go out, but not very far.
Right.
But not very far. And not for very long.
Yeah.
Yeah. So I like to I love to read.
Yeah.
One of my favorite things to do is to read. I love buying new books.
Are you a fiction or a nonfiction?
I do both, but predominantly literary fiction.
Okay.
Yeah. Like I love a bookstore. I love hanging out with my family, talking to my family. I have 2 brothers and 2 fantastic sisters-in-law and my dad. And
love it.
So I have a really great community.
Yeah.
Which is really helpful.
What are some of you? So you mentioned bookstores.
Yes. Absolutely.
You don't go very far, but when you do go out, where do you like to go? What are some of your favorites in KC that you want to shout out?
Ooh.
Shop, eat, drink.
Oh, okay. So yeah. Oh, okay. Hold on. Let me think.
Put you on the spot.
It
so happens to everybody.
I know. It's so hard. And I'm so uncool now that I don't know what all the good stuff is, like downtown.
You can just go to my page and follow along.
I think I'm going to have to, because every time I come across your stuff, I'm like, well, I got to go over here. I got to go to the Crossroads. I got to go to the West Bottoms.
And by the way, when people ask me like, oh, what's your favorite restaurant, or what's the, you know, your favorite that you went to recently? I'm like, I have no idea. I don't remember. And I have to go over here. I'm like, you might know if you saw my latest post, you know. So.
Okay, so I don't know of a lot of new places because I'm...
Sure. That's okay.
Yikes.
They can be old favorites.
Okay,
Doesn't
old
matter.
favorites. My favorite Mexican place is in Westport, Rudy's Tenampa, which is...
amazing.
God,
yep.
The best. They're absolute best.
Classic.
It's been my favorite for 25 years. I absolutely love it. My favorite Italian deli sandwich place is Bella Napoli in Brookside.
Yeah, great one.
Carmen's is if I really want like to indulge in some good Italian food. Carmen's in Brookside.
I haven't been to Carmen's. I gotta go.
You have to get
I'm adding it to my list.
Gamba asada plancha, which is bacon wrapped shrimp and Diablo sauce.
Yum. Yum, 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 yum.
Minty.
Okay.
Get out of town.
Okay. Maybe this weekend.
Fantastic. Let's see, what else? So yeah, bookstores. I love to go out to eat. Yeah. And I go out to eat alone a lot because I don't really have anybody else to go out with.
I actually like to go out by myself. I like to go like sit at the bar and have a glass of wine, and
I do that
a
all
lot
the
of
time.
times I have my laptop and
I bring my book.
I'm working.
Yeah, I bring my book.
Yeah, I think it's great.
Just sit and eat. Yeah, I mean I travel alone a lot. I mean I kind of spend a lot of time alone. But So yeah, and I live in Prairie Village right now, so I have a particular affinity for the Corinth shops because I live right there.
Yeah.
And it's super
So many
easy
good
to
spots
just
over there.
walk. I love a library.
Yeah.
I'm trying to think of other places that are hitting me, but
Or anything that you have not checked off your bucket list that you absolutely been wanting to do here that you haven't done.
there are so many restaurants I want to try.
Yeah, me too.
You
can't get to them all.
Many restaurants I want to try.
Yeah.
And I think I have a list on my phone.
Well, we can compare notes after. Yeah.
Because every time my clients come in, they're like, "Oh, we went to such and such a place," and I see both.
You're like adding.
Yeah, I see individuals and couples too.
Yeah.
And the couples will be like, "Oh, do you remember when we went to such and such a place?" And I'm thinking, just hold on one second.
Yeah, hang on. Yeah,
just what was the service like? How was it good? What was the menu?
Yeah.
But so I get a lot of recommendations from them. But then by the time I get home, I just think, whew,
yeah,
I'm pooped. I'm going to just have a seat. And
so Amy Poehler does something on her podcast, which I like, which is, what are you reading or watching right now that's really making you feel good or making you laugh? I like that question.
Oh, that's a great question. Making me laugh?
Make you laugh, make you
Or make
whatever.
me feel good. Okay,
Make you feel
so
good. Anything.
I'm doing, this doesn't make me laugh. I mean, sometimes maybe, but I'm doing my 5th rewatch of The Sopranos.
Oh my gosh. I find this fascinating. I have never watched anything like more than twice in my life, and it might be like Meet the Fockers or something like that. So I'm very intrigued with people.
Yeah.
And speaking of her, she has people who are like, "Oh, I'm rewatching, Parks and Rec for like the 10th time or something," and I'm so intrigued with that.
Yeah,
It does something for you.
something.
Yeah.
And I'm not a rereader. I won't reread
Okay.
anything. Once I read something, I won't reread it. But
Yeah.
for whatever reason, there are a few different series where I just want to rewatch them. And The Sopranos is one of them.
Love it.
Also, I love Real Housewives.
Which one? All of them?
All of them.
Perfect.
Yes. So I
Have you been into Salt Lake City lately?
Oh yeah.
Yeah.
Yeah. When's their new? Is their new one out already?
I don't know, actually. Yeah, I'm behind. I would need to catch up, but
Oh, okay.
I was always a Beverly Hills girl.
Oh, okay. Me
like
too.
that
But
one.
also Jersey. There's just something.
Oh, yeah.
Something so.
They have such like distinct
I
East
just
Coast
love
like
it.
demeanors.
I
So
love it. I
incredible.
love them all.
Yeah.
They all make me laugh.
I love
Like,
it.
Atlanta makes me laugh so hard. Jersey is just something.
Something else. Yeah.
So yeah, I do love some reality TV to decompress sometimes and just kind of turn off
Yeah.
the brain a little bit, which is great. Let's see, what am I reading? I read multiple things at once. I read
Okay.
a lot of books at once. I usually have something going that is professional.
Sure.
Like some sort of psychology book or some sort of trauma book.
Yeah.
Right now, am I listening to one?
I'm an audiobook girl.
Yeah, I do love an audiobook. I can't remember what I'm listening to. I must not have been listening to it this week.
That's okay.
That's okay. Otherwise, I'm reading fiction
Yeah.
and like really like literary stuff that,
Yeah.
I don't
Good
know.
little escape for you.
It is. I just go elsewhere.
Yeah.
So.
I love it.
But what makes me laugh most of the time are just people on TikTok and Instagram Reels are hilarious.
That's what I say. I'm like, I know social media is very detrimental,
It's
but
so
on the
toxic.
flip side,
But my
it is so funny.
God, it's hilarious.
Yeah.
Is it not so funny?
People are so witty. We never knew how many people in the world were so witty, so
Exactly.
entertaining.
I cannot. So my brother and my sister-in-law.
It's good for the soul.
Yes, we send reels back and forth to each other, and I will be
We do
in
too.
bed for an hour, just
dying.
howling with
Yeah.
laughter because people are just unmatched.
They really
are
are.
so funny, and
And
I
around the world.
I love people. They're
Yeah.
hilarious.
I
so
love it.
I guess the other thing that's making me smile at this point is World Cup. Right?
Oh my gosh, I know.
I totally forgot.
There's so much, and like today, because this will come out later, but today is the day that Netherlands is out and about. Have you
Yes.
been watching all of that?
Yes.
Like, it is wild.
Yes.
Like, I've sent it to my family in Chicago, and I'm like, you should see what's happening here. Like,
It's
this is
crazy.
insane.
I know, and I love it
So
so
cool.
much.
Yeah.
And I love how everybody's just really celebrating, and the energy of Kansas City right now is just
I know,
it's
I think
exciting.
people are not going to want it to end. You know, it's
know.
done something for this country that I am like, oh no, what happens after July?
After everybody goes?
I know.
What happens after all of the teams go home and there's no more World Cup?
But it has made a definite like permanent imprint on this country, like this whole event.
Yeah.
Which is cool. But we've had it in our lifetime. So
yeah, I think it's really exciting. Yeah. And what also makes me smile is that the Women's World Cup is next year in Brazil. And I can't wait for that because I love watching women's
Good to know.
Soccer.
So you've been to a current game?
I have.
Good.
Yeah. So fun.
It's the best.
Absolute. So much
They
energy.
did such an incredible job.
Fun. Yeah. So.
Oh, well, this has been so fun.
This has been great.
I feel like I need to go to one of your classes and like go sit in and just like
do.
absorb what
Come
maybe
audit.
like a good one.
We didn't talk about positive psychology.
Oh,
I forgot.
talk about it.
Okay, so positive psychology is a class.
That's what it was. I was like, what was one of the things that you're going to go back to?
I teach that in the spring semester at Park.
Okay.
And it is so great. So just super, very, very quick nickel tour of it is positive psychology doesn't ask what's wrong with you. It asks what's right. So positive psychology looks at strengths. So it's a strengths-based practice, I guess, of working through your stuff, right? So we look at, okay, well, maybe your response to that was considered maladaptive, quote unquote, which means maybe you wouldn't want to repeat that. But I bet you did that because it kept you alive and it's, a coping strategy and all of that. And it's just super fascinating. One of the best things that I make my students do is I make them do a gratitude journal once a week. And every single one of them at the beginning of every semester, gratitude journal, gratitude journal. And they're just huffing and puffing and mumbling about it. And by the end of the semester, every single one of them says, this was actually my favorite thing of the entire semester. I've absolutely loved it. I'm implementing this in my life. Gratitude, because gratitude will change your life.
Do not underestimate the power 100%. Of that.
Gratitude will change your life. So one practical tip to walk away from this is if you have a really terrible day or you're feeling really awful, make a gratitude list.
Love it.
Make a gratitude list.
Yeah.
Yeah. You'll feel better. It's really a positive psychology proven point.
Yep. Great reminder. Well, that's a good note to end on then.
Yeah. Nice positive end to the conversation.
Well, this has been incredible. I am so excited to have everybody here to hear what we talked about because, I feel that if there's something that I'm really interested in, clearly there's other people who want to know about it too. And to enlighten people with EMDR and you specifically here and how they can connect with you.
Well, I am thrilled. Thank you so much for having me. And please reach out if you have any questions.
Will do.
Yeah.
Thank you.
Thanks so much, Mindy.
Thank you so much for tuning in and finding inspiration in these incredible stories. If you love what you hear, be sure to subscribe so you never miss an episode, leave a rating, and share the show to help these Kansas City voices reach even more listeners.